Children with low muscle tone are at a greater risk of injury than other children because they don't have enough resting tension in their muscles to protect their joints or to react quickly when something unexpected happens. The key to safety and success when caring for children with low muscle tone is to understand what is dangerous for these children, use the right handling techniques, pay attention to what you are doing, and provide enough support to protect the child from injury. Why are children with low muscle tone so vulnerable to injury? Just like children who are asleep, children with low muscle tone can be awkward to pick up and carry and feel heavier than you'd expect. Because there's less tension in the muscles that surround their joints, it's common for some joints to hyperextend or move farther than you'd expect them to. Joints can also dislocate, that is, come out of their sockets, easily. Children with low muscle tone may not be able to control the position of their heads as easily as other children. They may also take a long time to develop or never develop other gross motor skills like rolling and sitting. They may not be able to tuck their arms and legs in automatically when you pick them up, so it's easy for an arm or leg to get left behind. Children with low muscle tone may not be able to crawl or stand. Because of these gross motor delays, they are also very likely to have fragile bones. Children with low muscle tone are also at risk of injury because you can't always tell just by looking at a child that his or her muscle tone is low. Earlier, we compared a child with low muscle tone to a child who's asleep. However, as you've probably already noticed, many children with low muscle tone don't look at all like they're sleeping. Kaiden, a preschooler with low muscle tone, is able to do a lot of things on his own, and as he sits and plays, he looks a lot like any other preschooler. However, if we look at him next to this other boy his age, you will see that there are things, like standing up, walking, and running, that are very easy for this boy, and that Kaiden can't quite do yet because of his low muscle tone and loose joints. For the same reasons, some things you could do with this boy on the left, like pull him up by his arms, would injure Kaiden. It's also important to remember that muscle strength and muscle tone are not exactly the same thing. Abian is a teenager with very low muscle tone. With years of hard work, he's developed the strength to hold his head up, move himself around with his arms, dress himself, and help with transfers, but his muscle tone is still very low. Children like Abian and Kaiden can be at special risk for injury because when people see all the things they can do for themselves, it's easy to forget that their muscle tone is low and their bones are fragile, so they need to be handled with extra care. Finally, it's also common for children's muscle tone to vary, be higher or lower depending on a lot of different factors, such as mood, illness, energy levels, and factors in the environment. In the next sections, we are going to talk about some general guidelines to keep in mind when handling, positioning, caring for, and moving children with low muscle tone. There are a few basic suggestions that help keep children with low muscle tone safe in most situations. Use the following safe handling basics with all care activities. When handling a child with low muscle tone, use a firm, gentle grasp and move body parts slowly and carefully to prevent accidental injury. As much as possible, use the palms of your hands or your fingers held closely together. This spreads out the pressure from your hands, minimizes the risk of bruising, and helps protect fragile bones. Always provide full support to the child's head and the rest of his or her body when handling or moving a child you don't know. Think of how you would pick up or move a newborn baby or a sleeping child. It is better to be ready with too much support and to be surprised by how much the child can help than to not offer enough support. Make sure you know where the child's arms and legs are at all times. Have you ever taken a baby out of a stroller or car seat and an arm or leg got caught because the straps weren't quite undone? That can happen pretty easily. In a child with normal muscle tone, like this little girl, it's not usually a big deal. However, that small amount of force can be enough to break the arm or dislocate the shoulder of a child with low muscle tone or fragile bones. Never pull a child or infant with low muscle tone up by the arms like this. If Julia had low muscle tone, her shoulders could dislocate or come out of their sockets. For the same reason, don't lift a baby or child up from under the armpits. Instead, find a way of moving the child that offers him or her full support and doesn't pull on any of his or her joints. Never lift a child's legs from the feet like this, as it can pull the hips out of the sockets. Get the child to help as much as he or she can. This will minimize the risk of injury. Make the child feel comfortable and secure. If the child doesn't know you, introduce yourself and explain. Good positioning of a child with low muscle tone provides support and stability, decreases the risk of injury, and makes it easier for the child to move and play. First, we will talk about positioning children in bed, on their backs and on their sides. Without supported positioning, children and infants with low muscle tone will tend to rest on their backs with their arms and legs flat on the bed. Can you see the difference in Zachary's posture and movement when he is supported and when he's not? Let's bring the rolls out from under the blanket and see how he's supported. The rolls on the sides help his shoulders come forward slightly so he can move his arms. The roll under his legs bends his hips and knees and makes it easier for him to move his legs. Now the rolls are back under the blanket. The folded cloth under his head helps keep his head in a good position. Together, all of these supports help Zachary achieve a flexed midline position, a position that is safe for his joints and good for his development. Remember that children with low muscle tone may not be able to move themselves if they are uncomfortable. Therefore, it's important to check on children with low muscle tone often and change their position regularly to prevent pressure sores. To position a child in side lying, roll the child to the side and place a bolster or other support behind the child's back. You would then place a folded blanket, small pillow, or stuffed animal between the child's knees to keep the top hip in a good position. This also helps prevent back pain, especially for larger children and teens. You may want to place another support, such as a roll, in front of the child and lean the child's body against that front roll. This support helps the child stay on his or her side and can also be used to support the top arm. Children with low muscle tone may also need extra support when sitting in a wheelchair or any other supportive seat to keep them in an upright, symmetrical position. Whether you are using a standard piece of equipment, like this baby seat, or a custom-designed wheelchair, the essentials of a good seated position for a child with low muscle tone are the same. Provide enough side support that the child does not slouch or lean to one side or the other. Make sure that the child's hips are all the way back in the chair, and provide enough support at the hips and between the legs to keep the child from sliding forward and slouching onto his or her tailbone. The support at the hips could be a groin strap, like this, or a combination of a seatbelt and a pommel, like Clarence has on his wheelchair. Finally, make sure that the child has something solid to lean his or her arms on, whether that is a tray or armrests.